Many of you know The West Wing is my favorite show. Not only my favorite show, but it is my number one go to when the world feels bad. I like to sit and watch The West Wing and pretending that that's the era that I'm living in. But it's interesting. One of the reasons why The West Wing is my favorite show is a specific moment. And I'm going to have the clip for you guys to watch in a minute. But there's a moment where President Bartlett is talking to a dairy farmer. He's trying to explain to him why government matters, why policy isn't just a number on a spreadsheet. And he says, if fidelity to freedom and democracy is the code of our civic religion, then surely the code of our humanity is faithful service to that unwritten commandment that says, we shall give our children better than we ourselves receive. He says to the farmer, I voted against the bill because I didn't want to make it harder for people to buy milk. And that line really sticks with me because here we are, over 2 decades later when that episode aired, and we're still asking people who are just barely getting by to carry more of the burden. It might have aired 25 years ago, but it's still relevant because it reminds us that public service is about protecting people who don't have lobbyists, that governing is about deciding who we help when no one's watching, and making sure that no one is left behind.
Governor Bartlett, when you were a member of Congress, you voted against the New England Dairy Farming Compact. That vote hurt me, sir. I'm a businessman, and that vote hurt me to the tune of maybe 10 cents a gallon. And I voted for you 3 times for congressman. I voted for you twice for governor. And I'm here, sir, and I'd like to ask you for an explanation.
Yeah, I screwed you on that one.
I'm sorry?
I screwed you. You got hosed.
Sir,
And not just you, a lot of my constituents. I put the hammer to farms in Concord, Salem, Laconia, Pelham, Hampton, Hudson. You guys got rogered, but good. Today, for the first time in history, the largest group of Americans living in poverty are children. 1 in 5 children live in the most abject, dangerous, hopeless, backbreaking, gut-wrenching poverty any of us could imagine. 1 in 5, and they're children. If fidelity to freedom and democracy is the code of our civic religion, then surely the code of our humanity is faithful service to that unwritten commandment that says we shall give our children better than we ourselves receive. Let me put it this way. I voted against the bill because I didn't want to make it harder for people to buy milk. I stopped some money from flowing into your pocket. If that angers you, if you resent me, I completely respect that. But if you expect anything different from the President of the United States, you should vote for someone else. Thanks very much, everybody. Hope you enjoyed the chicken.
Have you ever wondered, why does it work that way? Or thought, how can we thrive with Medicare Advantage under these conditions? You're not alone. Jenn has wondered all those things and more. Every month, join Jenn Kerfoot and a motley crew of friends as they bring you candid conversations with industry pros, break down important updates, and share insider tips to boost star ratings. Whether you've been around since before Medicare had the advantage or are just starting out, there's always something new to learn. Welcome to Stars Unscripted.
Hello, everyone, and thanks for joining us on this episode of Stars Unscripted. I'm your host, Jenn Kerfoot. It's going to be a little bit of a different format this time because it's just me, probably because everyone else is still recovering from their 4th of July weekend. I hope that everyone has had a safe holiday. And today I wanted to break down this one big, beautiful bill. It's a question that a lot of folks have sent me on LinkedIn, on email, on text, and I felt that it was worth an episode. I should probably disclaim that these views are my own and do not reflect the views of any organization that I am affiliated with, for the avoidance of doubt. So let's get into it. If you're not familiar, the One Big Beautiful Bill is also referred to as H.R. 1, which has currently gone through the House and the Senate and has passed by a very, very, very narrow margin. But I thought it'd be important this weekend to break down not only the numbers, but the people that those numbers represent. All right. So let me tell you a story. So it's 1965. A president from Texas, he signs a piece of legislation in Independence, Missouri, standing beside President Harry Truman, the previous president who 2 decades ago had tried to pass American universal health care. And that legislation gave us Medicare and Medicaid. They are 2 of the most consequential promises that our country has ever made. Promises. So Medicare says, grow old with dignity. And Medicaid says, poverty should not be a death sentence. I'm going to let you think about that. So fast forward to today. We got this new bill on the table, H.R. 1, the One Big Beautiful Bill Act. And I don't know if it's beautiful. I guess it depends on perspective, but it doesn't seem very beautiful to me. So it's sweeping, it's dramatic, it's big, and depending on who you ask, it's either budget reform or a wrecking ball with a good PR team. And it could be argued that they're not that great. So today I want to unpack what's in it, who it affects, and why. If you're one of the millions of Americans on Medicaid, Medicare, SNAP, it's not just another bill. This is your life. So when I sat down to really think about Medicaid, the way I like to think about it is it's not a handout, it's a handshake. So there's a really dangerous narrative making its way through the halls of power that Medicaid is a waste, a drain, a giveaway. And I'm going to rebuke that. So here's the truth. It isn't a handout. It is a handshake. It's between the government and its people, between parents and their children, and between a hospital and a newborn baby who does not care who won the last election. It covers 80 million Americans. That's 1 in 5. 1 in 5 of Americans are covered under Medicaid. It pays for 60% of nursing homes, half of rural births, and 40% of all children. And guess what? It works. When states expanded Medicaid under the Affordable Care Act, adult death rates, they dropped. Children on Medicaid, we can longitudinally see that they grow up to be healthier, earn more money, and rely on fewer public benefits. If that doesn't sound like the promise of value-based care, I don't know what does. And fun fact, it costs 22% less per person than private insurance. And it grows more slowly. It's cost effective, it's efficient, and it saves lives. So no, Medicaid is not broken. So while I was reading and researching for this episode, I tried to think, if it's not broken, why is H.R. 1 trying to break it? And how does it want to break it? It proposes over $860 billion in Medicaid cuts over the next decade. So one more time, $860 billion. That's not streamlining, that's severing a lifeline. The bill adds work requirements, which studies show do nothing to increase employment, but do everything to keep people off coverage. It introduces constant eligibility checks, which I'll go into a little bit. So if you miss a piece of mail, you can lose your insurance coverage. That's not exaggeration. That's not hyperbole. States have experimented with work requirements. Let's take Georgia, for example. In 2023, they launched work requirements. That has cost, ready for it, more than $90 million. $90 million. That's how much it's cost to roll out these work requirements, with only $26 million spent on health benefits. I don't know, math doesn't math. Then, in a wild twist, it forces, in this new bill, ready? It forces non-expansion states to expand Medicaid, but then it makes it nearly impossible for people to stay enrolled. That just doesn't make sense. It's a Kafka novel wrapped in a press release. So, according to the CBO, the Congressional Budget Office, 10 to 11 million Americans today would lose Medicaid coverage under this bill, while other researchers estimate 16 million Americans could lose coverage. That's not policy, that's cruelty. So I wanted to break down the numbers. Like, if this is what it's all about, if it's all about fraud, waste, abuse, cutting excess, let's run down the numbers. So Medicaid by the numbers. Actually, it's quite interesting. If you run these, it would appear that Medicaid is actually our country's unsung economic engine. It's pretty wild. So let's talk dollars before we talk devastation, which is 1, Medicaid is efficient. So administrative costs for Medicaid average about 5% of total spending. So that's significantly lower than private insurance, which can run anywhere between 12 to 18%. It has a lower per capita cost. So Medicaid covers high-need populations, but spends less per person than employer-sponsored insurance. So in 2023, Medicaid spent $7,970 per adult enrollee compared to $9,828 under employer coverage. It has the slowest cost growth. Over the past 30 years, per enrollee spending growth in Medicaid has been slower than both Medicare and private insurance. It boosts state economies. Every $1 of federal Medicaid funding brings $1.50 to $2 in state-level economic activity. It keeps hospitals open, creates jobs, and stabilizes local economies, especially in rural and underserved communities. It also prevents financial ruin. Medicaid covers long-term support services like nursing homes, home-based care, and adult day health programs that Medicare does not cover. Without Medicaid, millions of seniors would exhaust their savings or rely on family members to provide complex, full-time care. So who are these people that Medicaid covers? It's not who some politicians want you to picture. So children. Over 40% of all U.S. children are covered by Medicaid or CHIP. For kids with asthma, diabetes, or developmental delays, Medicaid ensures early intervention and continuity of care. It also covers seniors and people with disabilities. And it covers 60% of all nursing home residents. It also covers people with long-term disabilities like ALS, MS, spinal injuries, or developmental disabilities. It pays for long-term cares that, again, Medicare does not touch. Also, working age adults. This is really at the crux of what's been in the news lately, which is mostly low-wage workers. Think cashiers, childcare workers, restaurant staff, caregivers, grocery clerks, and people we clapped for in 2020 and seem to forget in 2025. Remember the pandemic? 63% of adults on Medicaid are in families with at least one full-time worker. So this idea that, people on these programs are lazy, they don't want to work. There is dignity in work, my girlfriend said the other day. And I agree. And I think that we need to remember that as we are looking at some of these sweeping changes that are coming down the pipeline. I'm going to cut in some B-roll. I really encourage you to watch the full video of a woman who is from West Virginia testifying in front of Congress talking about raising the federal poverty line. And granted, the clip is 5 years old, but I think it's still relevant. She references some folks in her hometown that can't afford to work, but they can't not afford to work. And I'll use actually an example from my experience, which is when I was at a previous job. I ran a very, very large call center, and I had an incredible supervisor, and I wanted to give her a promotion. And so I gave her a promotion that was $1 an hour more. And for those of you who can do some quick math with me, $1 an hour equals $2,080 a year, which doesn't seem like a lot of money, especially after taxes. But I wanted to recognize with something monetarily her, value to the organization. And when I gave it to her, I thought I was going to get, like a high five or like a thanks, Jen. Not that that was the point of me giving it to her. But actually what had happened really, really surprised me. What happened was that she knocked on my office door crying, and she said, "I need you to take back that promotion you gave me." And it really took me back, and I was quite confused. And I said, "Why?" She goes, "Well, if I make more money, I'm going to lose my healthcare, I'm going to lose my housing, and my children won't be able to go to daycare. So I need you to take back the raise, or else I'm going to have to quit." So I encourage you all to look at the video that we post as well, because that was not a unique interaction that I had. That is the lived reality of millions of Americans within our nation.
My name is Amy Jo Hutchison. I'm a single mom of two who's lived in West Virginia all my life. I'm also a community organizer for West Virginia Healthy Kids and Families, Our Future West Virginia, where I organize and advocate for poor and marginalized folks. Today, I'm here to help you better understand poverty because poverty is my lived experience. And I'm also here to acknowledge the biased beliefs that poor people are lazy and that poverty is their fault. But how do I make you understand things like working full-time for $10 an hour is only about $19,000 a year, even though it's well above the federal minimum wage of $7.25 an hour? I want to tell you about a single mom I met who was working at a gas station. She was promoted to manager, and within 30 days, she had to report her new income to DHHR. Within 60 days, her rent bumped from $475 to $950 a month. She lost her SNAP benefits and her family's health insurance. So she did what poor people are forced to do all the time. She resigned her promotion and went back to working part-time just so she and her family could survive. Another single mom I know encouraged her kids to get jobs. For her DHR review, she had to claim their income as well. She lost her SNAP benefits and her insurance, so she weaned herself off of her blood pressure medicines because she, working full-time in a bank and part-time at a shop on the weekends, couldn't afford to buy them. Eventually, the girls quit their jobs because their part-time fast food income was literally killing their mother. You see, the thing is, children aren't going to escape poverty as long as they're relying on a head household, who was poor. Poverty rolls off the backs of parents and right onto the shoulders of our children, despite how hard we try.
Another group of individuals that would be cut is actually veterans and formerly incarcerated individuals, which is that 1.8 million veterans rely on Medicaid. 1.8 million veterans. And it's often for services that VA doesn't cover or when VA access is limited. Also, fun fact, ladies and gentlemen, Medicaid expansion, it has provided and played a key role in reducing recidivism, which is offering reentry support and mental health care for justice-involved individuals. So, looking at this one big, beautiful bill, it really puts some of the most vulnerable, not even just some, it puts all vulnerable Americans in its crosshairs. Trump's legislation requires states that have expanded Medicaid to charge enrollees up to $35 for some services if their income are between the federal poverty level, which this year is $15,650 for an individual, and 138% of that amount, which is $21,597. This is one of those policies that looks small on paper, just $35, but it hits hard in reality. We're talking about people who earn between $15,000 and $21,000 a year. That's poverty level or just above. So for many, $35 isn't a copay. It is 3 days of groceries. It is a utility bill. It is a choice between picking up a prescription or paying for gas to get to work. It's not about cost sharing. It's about cost shifting. It's about taking a federally funded program designed to lift people out of medical and financial crises and handing the bill to the very people it's meant to protect. And it isn't hypothetical. Studies show that even small copays lead to fewer doctor visits, skip medications, and more avoidable ER trips, which ironically cost the system more. So not only is this policy regressive, it's also woefully inefficient. And in a country where we subsidize corporate agriculture and oil, telling the working class people they need more skin in the game just to see the doctor is not a fiscal responsibility. It's cruelty dressed up as economics. Low-wage workers with unpredictable hours. Work requirements demand consistency that doesn't exist in industries like hospitality or retail. So listen, one missed timesheet equals one missed healthcare renewal. Parents and caregivers, many will be forced to prove work participation or risk losing coverage while the child they care for still qualifies. So imagine being a mother with cancer, losing your Medicaid while your toddler's insurance remains intact. People with disabilities in non-institutional settings, so home and community-based services, HCBS recipients could face massive delays or loss in services if states can't maintain funding. And don't get me started on rural Americans. Rural hospitals rely on Medicaid funding almost exclusively. Cutting coverage means fewer insured patients, more unpaid care, increased hospital closures, and as of 2025, 1 in 3 rural hospitals is already at risk of closing due to financial strain. So the bottom line is Medicaid is not a failing system. It's the largest, most efficient, and most targeted health program in the country. Cutting is not a budget strategy. It's an ideological statement. And the people who suffer, children, seniors, the disabled, the working poor, they won't be testifying before Congress. They'll be standing in line at an ER or choosing between insulin and rent or watching their rural hospital close with no ambulance in sight for 80 miles. Now, you might be thinking, well, at least they're leaving Medicare alone. Not quite. The bill includes a citizenship verification clause. That means lawful immigrants on Medicare, many of whom paid into the system, could be kicked off. And here's the catch. The massive tax cuts in this bill would explode the federal deficit. And when that happens, Medicare becomes the piggy bank that Congress raids. We're talking up to $500 billion in automatic Medicare cuts unless they override it. Less money means fewer benefits. Fewer benefits mean more out-of-pocket costs. And what that means is a whole lot of seniors, especially low-income seniors, will feel the squeeze. The last part that I also wanted to bring up was SNAP and EBT. You cannot build a great nation on an empty stomach. The Supplemental Nutrition Assistance Program, which many know as food stamps, helps feed nearly 40 million Americans. H.R. 1 proposes a $295 billion in SNAP cuts. That is, if you do the math, 4.7 million people expected to lose food benefits. And for people who remain, smaller grocery budgets, tougher rules, and higher hurdles to keep food on the table. And the bill raises work requirements. So if you're 54 and you can't find a job that fits your health or childcare needs, tough luck. Your EBT card stops working. Forget let them eat cake. This is more of a let them eat bootstraps. And that's just wrong. So if we look at really the downstream impact of what starts to crack, what breaks, when you pull this many people off Medicaid and SNAP, hospitals, especially in rural areas, lose revenue and they start shutting down. Doctors stop accepting Medicaid and emergency rooms fill up with people who waited too long to get care that they couldn't afford. Medicare Advantage plans, especially dual eligible special needs plans, get the squeeze. When Medicaid stops covering long-term care or cost sharing, those seniors now face a higher out-of-pocket cost. Plans might cut benefits or raise premiums. And from a jobs perspective, these cuts could cost the economy 1.2 million jobs by 2029 and wipe out over $12 billion in state and local tax revenue. Let that sink in. We're told this bill is about responsibility, about reducing waste, about tough love. But policy is a reflection of values. And values are about who we protect when no one is watching and when there's no campaign check waiting on the other side. This bill does not reflect the best of us. It reflects the fear of too much fairness. It reflects the cynicism that says the poor are gaining the system and billionaires are the system. Here's the truth. We don't need to choose between fiscal discipline and moral clarity. We can invest in people and balance the books. We can fund the safety net and build a stronger economy. But that takes more than a slogan. It takes leadership, it takes truth-telling, and it takes all of us demanding better than what's wrapped in a bow and called beautiful. Because there's nothing beautiful about pulling the rug out from over 18 million people. Thanks for listening. Take care of each other. And keep fighting for a country where no one has to beg to see a doctor or feed their children.
As a Medicare Stars professional, you're on a mission to boost your plan's ratings. But complex data and endless metrics make it more than challenging. Enter Stars Monitor by Hyperlift, your guide to improved performance. Our dashboards pinpoint your most impactful opportunities. By focusing on what truly matters, you'll avoid the pitfall of missed targets and achieve the goal of steady improvement. Take the first step towards your Stars success story. Email results@hyperlift.com for a free demo. Stars Monitor by Hyperlift, providing speed to clarity.